Hey there, everybody. We're back for part 2 of digestion. So we talked about mastication, chewing, and dentition, your teeth, for the first part of digestion. Oh yeah, and there is the parotid glands on either side of your head that secrete amylase. The next thing we're going to talk about is your stomach. So we all know we have it there. It actually sits a little off to your left, under the left rib area. We all think the stomach is that whole area down there. That's not the stomach. So what happens is when you swallow the food, and now it's called bolus, it goes down your throat, past what we call the cardiac sphincter, which is a circular area that kind of opens to let things into the stomach, and then it closes. It has to close tight in order to keep the food and the juices from the food in the stomach. Now, when that sphincter gets loose, that's when we have a little bit of acid reflux. We'll talk about that at another time. But what I wanted to talk about today was the role the stomach plays in digestion. So the stomach has a couple of different roles. First of all, it secretes a bunch of different juices, hydrochloric acid, some other acid chymes, things that break food down. So when we take something purple, a purple pill, to help reduce the acid, we're actually lowering our digestion. So the body needs this food now that we've swallowed, or the bolus, broken into small pieces so that we can break it even smaller and get the nutrients we need from it. Now the stomach has 3 layers. So it has an up and down layer, a side to side layer, and a layer that runs on an angle. So when the food goes in there, the stomach actually has this wave-like movement. I'll use a very important word here. It gushes the food. So it gushes the food up until it senses it's at a certain consistency. When the food's at the consistency, which is good for the small intestines, then it will pass it on to the small intestines. But the problem is the digestive enzymes that sit in our stomachs, by the time we're 33, we've lost 1/3 of those. And we continue to lose incrementally amounts of those digestive enzymes as we get older, which is why it's so important to make sure your digestion is in good shape by possibly taking a digestive enzyme, or sometimes eating food raw. I'm not talking about raw meat. I'm talking about maybe occasionally some raw vegetables, because food actually does have the enzymes in it to break it down that we need. So once that food is in the stomach and it's gushed up, then it gets the opportunity to move on to the next stage. It opens up another sphincter from the stomach called the pyloric sphincter, and it empties that food content, that juicy stuff now that should be broken down, into the small intestine. So if you don't chew it up well in your mouth, you don't have enough saliva and whatnot to get it down your throat and get it broken up properly, the stomach's got a bigger job than what you realize. So then that puts the stomach at a disadvantage. So make sure your teeth are working well, you've got enough hydration in you, your amylase is getting secreted properly from your parotid glands, and that would be that you're not dry, swallowing dry food, and that you actually do have enough acid in your stomach. And so we never want to shut that off in natural care. We always want to promote hydrochloric acid rather than shutting it off with a purple pill, because then you have problems. So if you know somebody having some of those problems, have them come see Dr. Ray and feel better today. We'll talk to you in part 3.